Hello, everyone, and welcome to my master topic presentation. Today, I will be talking about HIV and AIDS. So, HIV, which is known as human immunodeficiency virus, is a virus that attacks the immune system. And when it's left untreated, that can turn into AIDS, which is acquired immunodeficiency syndrome. That leaves you with the weakened immune system, which then can lead to many other problems and diseases in your system. It was first reported in the New York Native in 1981. But about a month later was when it was first clinically reported. And here is a screen capture of the report. And one of the earliest names for AIDS was, or I guess HIV/AIDS was the 4-H disease, because it largely affected homosexuals, hemophiliacs, Haitians, and heroin users. So instead of calling it the disease where this happens and this happens and this happens, they called it the 4-H disease. And it wasn't until September of 1982 that AIDS was used regularly. And then in 1983, it was discovered by Robert Gallo and Luc Montagnier. It was them who discovered that AIDS was caused by the virus HIV. So the virus is spread when you come into contact with the fluids of a person who is HIV positive. And these fluids can include blood, semen, rectal fluids, vaginal fluids, and breast milk. And the most common way to spread it is having sex with someone who is HIV positive, and also sharing needles with HIV positive people. So having unprotected sex, sharing needles, and unsafe medical procedures are the biggest risk factors for getting HIV/AIDS. And if left untreated, your life expectancy is about 11 years. And some of the symptoms, early on, you just kind of have flu-like symptoms. So you get a fever, you get a cough, nausea, just flu-like symptoms. And as it progresses, your lymph nodes increase in size, and you also get a significant weight loss. Anyways, as it progresses, there becomes a larger interference with the immune system. Currently, there is no cure for AIDS, but with the right treatment, your life expectancy can return to almost normal levels. Some ways to prevent yourself from getting HIV include using condoms, pre-exposure prophylactics, which include medications like Truvada, which I'll explain about in a little bit, and needle exchange programs where needles are given to people at no cost. And some early treatments included things like Chinese cucumber root and yolks from hen eggs, but surprise, surprise, both were found to be very unsuccessful in treating the HIV/AIDS. One drug that was found in the early stages one drug that was found to be helpful was AZT, and it slowed down the development of AIDS, which was, an amazing discovery, but unfortunately had kind of a pretty bad side effect. It decreased your bone marrow by 40 to 60%. And so it put people in a conundrum because it was either take the AZT and slow down the development of the AIDS, or take the AZT and decrease your bone marrow. So over time, with the use of other drugs as well as the AZT, it was actually found that the doses they were using of the AZT were pretty high. So they lowered the dose amount and then combined it with other drugs to kind of make like a prescription cocktail. That's been proven to prolong the lives of HIV positive people. Another thing too is that it's possible to reduce the viral load to undetectable levels. And that means that there's really no risk in transmitting the disease. And another drug that has been gaining traction in recent time is Truvada, which is a drug made by Gilead Sciences. And it has shown to suppress HIV in those infected, and stopping the transmission of AIDS by blocking an enzyme called reverse transcriptase. And that's the enzyme that the HIV virus uses to replicate itself. So why is this important today? Well, it's important today because in total, around 40 million people have died from AIDS since it was first. And just in the past year alone, there have been 680 people who died from HIV-related causes, while another 1.5 million acquired the disease. Although the numbers show that that is a 30% decline since 2010, which is pretty good. But of those 1.5 million that acquired it, 160,000 were children. And so it's not only affecting adults, but it's affecting young children. And there's also approximately 165,000 people in the US that don't even know that they're living with HIV. So it's important to get tested regularly if you're sexually active with multiple partners, because you could be a danger to yourself and many others if you're not. And currently, there is about 37 million people living with HIV, and 10 million of them are not getting the treatment. So they're not able to get, the medications to help prolong their life, which again affects them and their families. So it's important that we get the proper resources to the people who really need them. And another thing too is people don't really have the right information. Either they don't have enough information to know about HIV, or the information they do have is wrong. And so it's important that we bring awareness to other people on some of the facts, because in a British survey, it was found that people thought that the virus could be transmitted through kissing, spitting, sharing a glass, or sneezing and coughing, which isn't true. And in another study, it was found that 1 in 5 people in a study of 343 believed that HIV did not cause AIDS, which again is not true. HIV does in fact cause AIDS, and that the drugs did more harm than good. And although the AZT drug was found to decrease bone marrow, in use with other drugs, it's found to be extremely helpful with little side effects and risks. And there's other misconceptions too that people, think like that only gay people can get AIDS, so they feel like that they don't have to be as careful because they're heterosexual, and so they can't get the disease, which is extremely false. And another thing too is there is a lot of discrimination toward people with AIDS. And we need to understand that these people are human too. It was not their choice to go and get AIDS or get infected. It just happened, and these people need our help. So it's important to not be hateful toward others who are living with this.